Pro-Life Advancement and Education Partners, PLAEP, is a faith-based community organization located in Kitwe, Zambia. PLAEP was formed in 2004 to provide an evangelical Christian response to HIV and AIDS. Over the last few decades, the government of Zambia has been responding to the daunting HIV challenge. The U.S. aid in Zambia confirms that the impact of HIV/AIDS is multidimensional, long-term, and not isolated to those who are stricken with the disease. Large numbers of people in their prime years have died and left behind children. Zambia's traditional extended family system has been stretched to the limit. According to Zambia's Central Statistics Office, 10% of Zambia's population, that is, over 1 million children, are classified as orphaned or vulnerable. Providing care and support for the large numbers of orphans and vulnerable children that have resulted from the HIV/AIDS pandemic is a huge challenge. Available resources are overwhelmed. In spite of the government's response to scourge through provision of antiretroviral treatment to people living with HIV and AIDS, increased treatment of opportunistic infections such as tuberculosis, biomedical services such as prevention of mother-to-child transmission, and male circumcision, and increased voluntary counseling and testing services, high infection levels continue being recorded in Zambia. According to the 2012 District AIDS Task Force report on HIV, only 7% of the total population in Kitwe have access to voluntary counseling and testing services, and only 2% of the HIV-positive people are on antiretroviral therapy. This reality is perilous and heightens the need to continue efforts on mitigating the various challenges of HIV and AIDS. In response to those pressing needs, PLAEP has been addressing predisposing factors to HIV/AIDS infections, such as gender-based violence, alcohol and other drug abuse, and economic vulnerability that are all prevalent in PLAEP target communities. Some of PLAEP's activities include a monthly outreach. Every month, 200 adults are reached with HIV/AIDS prevention information through adult community facilitators in PLAEP target communities. Additionally, PLAEP promotes sexual abstinence in the youth through a peer outreach that reaches 400 youth monthly. Also, in 2011, PLAEP initiated the Be Faithful and Abstain BIFA Games. This is a sports tournament through which PLAEP reaches over 1,000 youth annually with life skills and HIV/AIDS prevention information through football, netball, and volleyball.
My name is Moses Kombe, peer educator for PrEP. Me as a peer educator, I've benefited a lot, more especially that I've learned such that the importance of abstinence as well as the effects of not abstaining. Coming to the peers, we do go for outreach within our communities as well as other schools, yes, such as Kito Boys, that's a government school. Then also not only government schools but also we do go in private schools, yes. And what we teach in those schools, we do encourage the youths to abstain because it's the only effective way which can help them achieve their goals.
Since 2012, PLAEP has promoted community savings and credit groups among the poor and vulnerable women through the Grow SHG concept. Over 200 people are now saving in these groups, and these groups have afforded access to borrowing, to enable the women inject capital in their businesses and also enable them meet other family needs and various needs such as school fees, food, for home. These groups have also, become safe spaces for discussion on socio-economic, challenges affecting them as members of the community. In addressing the challenge of illiteracy or of the women who are members of the GROW SHGs, PLAEP has started a literacy class for women where they are learning, basic skills in reading, in math, and in writing. In 2013, PLAEP pioneered, in Kitwe district, where we are working, community discussions on the harmful effects of alcohol and other drugs abuse through groups called psycho education groups. Every month, PLAEP reached over 200 young people, promoting, to these groups abstinence from alcohol and other drugs. And this was done in schools, in churches, and other community groups.
Another activity to improve child nutrition and health, school attendance, and school retention, particularly for young girls, is through the feeding program. PLAEP introduced the school feeding program at Musanda Community School just a few years ago. This project provides income for widows and vulnerable women who help out with the food preparations.
Ichakubalila pofye fwe tuletotela leso muine pali i program pantu leso muine otwingatangisha muri fyonse ewaleta i program olo tuleta shana madonors abaletu afuirisha pamona ba madam ba Mrs Kambole muri i program nga kuno fwe bafyasha bakuno kwa Msonda tuletotela sana kuli ababana pantu kufumapo program yatampile ipano pa school fintu at least fyali chinjako kuchilofo fyali na fwe bene fwe bale bomba muri program omuntu wayingira muri inchito bambi tuli mawidows tatwa kwata abalume elo bambi bakwe batirimbi abana bali fula so ubwafuirisha ubaleleta at least shirempyo sho wetu afurisha ko kutufuresha shiretu afuirisha kupamanda bakusunga abana.
Every year PLAEP provides educational support to orphans and vulnerable children through community schools, and we have community schools, namely Kamawe and Musonda community schools. The total number of children in these schools is over 500, and the support that PLAEP gives is through books, pencils, school fees, and supporting the teachers, uniforms, and other educational requirements. We also give support to children that that move from the community schools to secondary schools, and also provide scholarships for some children in college.
Additionally, PLAEP psychosocially supports orphans and vulnerable children through skill-building training, such as It Takes Courage. Through this training, PLAEP aims to build character, resilience, and self-esteem in the youth as they face the world of HIV/AIDS. In addition, crafts and various accessories are made from locally mined and processed semi-precious stones as an income-earning activity for the organization and for the girls and women in PLAEP target communities. Lastly, PLAEP, in partnership with the United Nations Office on Drugs and Crime, has trained 20 community facilitators as trainers of trainers to conduct parent-child communication outreach to fellow parents in the community. Our aim is to build relationships between parents so that they realize and take up their roles as primary educators in their homes.